Greetings, Charles County. Today is Friday, February 5th. My name is Jen Harris, and I am the Chief of Media Services and your Public Information Officer during the COVID-19 pandemic. I am returning to our podcast today to help you get the latest information regarding the fight against COVID-19. Here in Charles County, since the pandemic began last March, we have 8,232 confirmed cases. Tragically, 144 Charles County residents have lost their lives from COVID-19 complications. This has been a difficult year for our community, no doubt, and more tough days are still ahead of us. However, we care deeply about your health and well-being. We're continuing to provide all the information and resources that we can to help against the fight with COVID-19 and just ensure you get through it healthy and safe. Let's shift the conversation to something that's been top of mind for many people in our community lately, and that's the vaccination process. To date, Charles County has administered 9,319 doses of vaccine, including 8,516 first doses and 803 second doses. Individuals in Phase 1A, 1B, and 1C have been receiving these doses, and that includes our healthcare providers, our first responders, those in nursing homes, both staff and residents, older residents, ages 65 and up, our teachers, and a limited number of individuals in specific groups such as congregate settings and those who are in essential jobs. Now, while we have vaccinated a few thousand individuals, we have many more thousands who are currently eligible. In fact, Governor Hogan said just last week that while 2 million Marylanders are eligible to be vaccinated right now, the state is only receiving about 72,000 doses a week. So many, many more people are waiting to be vaccinated than have already been vaccinated. So we're going to talk a little bit more about that today and how that's affecting us locally in Charles County, what we are doing to help get the vaccine into arms as quickly as possible, and what you can expect in the next few weeks as we continue to ramp up and offer you a little bit of hope about the future. I'm joined today by Dr. Dianna Abney, MD. She is our health officer here in Charles County, and she's going to provide you with some updates about where we're at in the process and what's next. Welcome, Dr. Abney.
Thank you, Jen. I'm glad to be here.
Can you provide us with some information on when the vaccine was first received in the county and how it's been distributed over the past few weeks?
So the coronavirus vaccine first arrived in our community in mid to late December. The Pfizer vaccine arrived first in mid-December, and Moderna started to flow in late December. It is essentially being distributed through the hospital to their employees and now to some people in the general public and through the health department.
If you are in one of the groups eligible to be vaccinated, how can you pre-register and what should you expect once you do?
So if you're in one of those groups, you can sign up on our website if you want to pre-register. Then you'll be contacted by the health department when there's an appointment available for you. So after you sign up, wait patiently, and you'll receive notification from the health department when there's an appointment for you.
So, Dr. Abney, can you tell us about how many people have already pre-registered and the enormity of the demand for the vaccine right now? I think that will give our community a little bit better understanding of, while they're waiting for appointment, why that process takes some time.
Right now, over 15,000 people have signed up for the vaccine. And these are people in groups 1A, 1B, and 1C. So there are a lot of people who want to get the vaccine, but as you said, only about 72,000 vaccines come into the state per week. So there's a lot of people who want it, thankfully. So we just have to be patient as the amount of vaccine coming into the state increases. One of the things I'd say to you, though, is to the public, though, is please do not pre-register more than once, because what that does is that just increases the number of that 15,000. It just goes up, and then we have to wade through duplicates in order to find the people that we need to send out the invitation to come for an appointment to.
So let me just reiterate to our community that if you've pre-registered, you're in our system. You don't need to worry about registering twice. And keep in mind that you won't get a confirmation email. You'll be waiting for contact from the health department to let you know when an appointment is available and how you can sign up online to make that appointment. And that will be an appointment at this point at Regency Furniture Stadium, where we are currently holding clinics held by the health department. Now, I know there are other places offering vaccinations right now. Dr. Abney, can you talk about a couple of other options people may have heard about or being considered?
Certainly. Giant Pharmacy in Waldorf has vaccine in their store, and they've already started to offer it. And there are some other retail partners who will be offering vaccine in the near future. The hospital is also offering a vaccine to the general public. They also, though, have a waiting list.
So we've heard also that the governor has recently announced some mass vaccination sites statewide that any resident of Maryland can go and try and make an appointment to get vaccinated. Can you talk about where those locations might be?
Right now, there are 2 mass vaccination sites in the state of Maryland. One is in Baltimore, and the other one, which is a little closer to Charles County, is in Prince George's at Six Flags. Those 2 are open now, and there are several others planned for different parts of the state in the future.
So I want to encourage the public, if you want more information about that, you can go to covidvax.maryland.gov, and they will have all of the details about how you can sign up for appointments at retail pharmacy locations or at one of the mass vaccination sites that's currently open. So thank you for sharing that, Dr. Abney. Next, I want to turn to vaccine availability. We've talked about how limited it is right now, but do we expect that to increase in the future? And if so, what will that look like? What should people be expecting in the next few weeks?
So I do expect it to increase in the future. I'm not going to promise the next few weeks. However, what you might recall is that our President Biden, has committed to obtaining over 100 million doses of the vaccine to be given out in its first 100 days. There's also a third vaccine that is about to hit the pipeline. That is the Johnson & Johnson vaccine. It is going for emergency use authorization in the near future. In fact, it may be authorized as early as either late February or early March. You also might have heard that this is a one-dose vaccine.
And that's good news, right? Because people won't have to return for a second appointment and they'll achieve immunity sooner, correct?
That is good news. You will have your immunity with just one shot. And then, you, as you said, you won't have to go for second appointment. So that will actually leave more space on calendars for more people to get vaccinated.
I know, Dr. Abney, you and I have had lots of conversations about how the vaccination process may change our lives, but do we expect any difference in the near future? I mean, will people, once they get their vaccine, be able to travel about the United States as they did before, stop wearing their masks or changing their behaviors in any way? Or do they need to take their time in doing that? What advice would you give to our community so that they know what to expect and anticipate? Because it sounds like, by very late spring, we may have a much larger part of our community vaccinated, but will that change the behaviors that we're currently practicing, or would you encourage people to keep doing that?
So what I want people to remember is that this is not the magic bullet. This is just one of the things that we have to help us fight against the COVID virus. We still need to do all of the COVID virus mitigation factors that we're doing now. We need to do what I like to call the 3 W's. Wear your mask, watch your distance, try to remain 6 feet or further from other people, and wash your hands. You should wash your hands for at least 20 seconds with soap and water. And if that is not available, you can use hand sanitizer that is at least 60% alcohol. You also need to remember that when you're out and about, you're putting yourself and others at risk. So as much as possible, stay home and don't do things that put you in too large of a crowd. And while we're talking about things that put you in a crowd, don't go to parties, don't go to Super Bowl games, parties, and try not to have any unnecessary travel.
Okay, thank you for that. I know that contact tracing has shown those are the most common ways that the virus is being transmitted in our community. So I really want to emphasize to people who might be thinking that, this is an invitation to open up their home, have a party, regather their family, that we're not quite there yet, and we won't be there for a little while to come. For those who might be hesitant to get vaccinated, let's say you're in 1A, 1B, or 1C, and you're saying, no, I don't trust that vaccine. It was developed too quickly. I'm not ready to get vaccinated yet. What would you say to those folks who are eligible but have at this point not decided to put their name on a list to get vaccinated?
Well, the first thing I would say to you is that the vaccine is safe. It would not have been authorized in our country to be used if it were not. Some people worry about how quickly it was made. What I'd say about that is, even though we've seen it come about in about a year, the research that helped us develop this vaccine started about a decade before this. And even though it only took a year, where other vaccines take a while, that has to do with the fact that this was an all-hands-on-deck situation. Companies put most of their effort into working on this one vaccine because we were in a pandemic, and funding was not a problem. So they didn't have to take as much time searching for funding, and they weren't working on other things at the same time.
Basically, it was an all-hands-on-deck effort worldwide.
It was a worldwide, and it continues to be a worldwide all-hands-on-deck, because there are still some vaccines in the pipeline. We talked about one that is coming very close to being ready for emergency use authorization, the Johnson & Johnson vaccine, and there are several more behind it. One of the other things that people worry about is just fear of something new. And I would tell people, compare that to other new things that you take for your health. For example, if you take a regular blood pressure medicine or heart medicine, if your doctor suggests to you that this new medicine is better at keeping your high blood pressure under control, you're likely to believe and trust your doctor and try the new medicine. Look at this in the same way. This is something that your doctors are suggesting to you to have because it will help take care of you. Look at it in the same way as you would look at a newer medicine.
So our doctor, Dr. Abney, who's our doctor for the community, is also saying the same thing. This vaccine is safe. We encourage you to get it, and we encourage you to get it when you're eligible to get vaccinated. So thank you for sharing that, Dr. Abney. I also wanted you to share a few details about potential side effects people have expressed concern about. I know you've been out at most all of the clinics that have been held here locally by the health department. And so you've seen firsthand what potential side effects can occur and what they look like. And I want you to just for a minute address some of the concerns people have raised about that.
So the most common side effects are pretty mild. People will sometimes have a little pain at the site of the injection. They'll have redness or soreness in their arm. Think about the time when you've had to get a tetanus vaccine and your arm was sore after you got the vaccine. And some people may be a little tired. Those are local reactions. Some people may also have what we call systemic reactions. They might have a fever. They might have some chills. And they might feel very weak and tired. All of these problems or all of these side effects usually go away in about 2 to 3 days. So they're expected. They're things that you can often see. Many times you see them more with the second vaccine.
That's good for people to know. I think some folks would say, well, are these symptoms of COVID-19? Did I get the injection and now, I'm getting sick from it? It's important to distinguish that this is not a live virus, right? Your immune system is just amping up its antibody response to recognize it. Is that accurate?
That is exactly right, Jen. It is not a live vaccine. It cannot give you COVID. So you are not having COVID when you have these side effects. Okay. And these side effects are different than the symptoms of COVID. So you might have a symptom fever with COVID. You might have some chills and fever, but those things last longer, and you might have other symptoms that go along with COVID. One particular one is loss of taste and loss of smell. We do tell people if you have symptoms that look like COVID, that last longer than the 2 to 3 days, you should see your private physician or you should go to a clinic and get evaluated.
Well, thank you for sharing that information. That's all we have for today. I know we're going to be getting together at least once a week to talk about the latest information as it's constantly a moving target in terms of what we know about vaccine availability and sites that are opening up and who's eligible to get vaccinated. So this is just one more tool we're going to be using, where Dr. Abney and I will be talking frequently with the community so that everyone has another way to stay informed, and share this information with your friends and family and your neighbors too, so they also can get the latest information about what's going on here in Charles County. That's it for our news for today. We want to remind you, as always, please wear your face mask when you go out of your home, watch your distance with others, and wash your hands frequently. As a reminder, the Super Bowl is coming up this Sunday, and we know that 46% of our cases here in Charles County are spread through house parties and family gatherings. So please, help us keep the tide of COVID-19 cases in check. I know they've been declining recently, and that's great news. We want to keep that trend going by continuing to just remain at home with members of our own household watching the game. We can still all have fun. Maybe we can even have virtual parties together. We also urge our community to stay informed with facts. Get them from credible sources. As we talked about when this pandemic first started, you want to go to the CDC or the Maryland Department of Health or charlescountyhealth.org for your facts and information. A lot of the information that's shared from other sources, not always credible, not always vetted. So you want to make sure you're not contributing to misinformation by sharing things online that are simply not true. You can call the health department's recorded message hotline anytime for the latest information. That number is 301-609-6710. We also have a staffed call center available for advice and pre-registration support. 301-609-6717, and that's available Monday through Friday, 8 a.m. to 5 p.m., Saturday and Sunday, 10 a.m. to 3 p.m. Follow us on Facebook and Twitter. Sign up for the e-newsletter, which comes out at least weekly. You can also sign up for our text and email alerts through our citizen notification system. And you can watch CCG TV on YouTube or on Verizon Channel 10 and Comcast Channel 95 locally. These are all the places where you can find us, in addition to which you can go to charlescountymd.gov to find out more about how you can connect to all of these platforms. Thank you again for listening today, and we'll return soon for more information on COVID-19 and how we're getting through this pandemic together.